All right, hi everyone. Got a bit of a treat for you today. I am talking with Dr. Nick Seddon. He runs Oceanfront Dental in beautiful downtown Vancouver. He and I go a little bit back. We met in grade eight, and we haven't caught up in a while. We're supposed to do this in person, and things happen. We're in the midst of a strange time right now. But I want to catch up with Nick and also see what he's up to and yeah, see what else is going on. We might also have some fun stuff near the end here too. So Nick, thanks for joining us today.
Thanks for
And
having me.
how are you doing?
I'm doing good. I had a busy day seeing lots of dental patients, all of which were emergencies.
Hmm.
So I've kind of put down my cosmetic dentistry skills and took on more of a emergency dentistry skills. So I'm doing a lot of root canals and extractions and really deep fillings. So I feel like I'm back in dental school again. So it's kind of fun actually.
Fun times.
Yeah.
Root canals. So actually, right at the beginning of all this COVID business, at the beginning of March, I ended up getting a root canal from just a very deep filling.
Yeah.
So I got a temporary crown put on, and then of course everything shut down, right?
Yeah.
And then when I started eating one day, I just bit right through the temp crown. So yeah, luckily my dentist, did whatever he could, and we declared, it was a bit of an emergency, and I was able to go in and get the permanent one on. Otherwise, yeah, I wouldn't be eating what I want to eat right now if it wasn't for that.
Fair enough.
But tell us a bit about Oceanfront Dental. Like, how long have you been running it now?
It's crazy. Time flies. I've only been here for about 5 years, but it feels like 5 months.
Mm.
No, but it's been great. I used to work on the North Shore, and then I felt as though the practice that I had was a little small. I only operated out of about two operatories, and I had like half a hygiene op. And so, as we'd get more new patients, we just felt like I was at capacity pretty early on, and I had that practice for about 8 years, and so I was ready to move into something bigger. So this is a very large practice. It's right below the Fairmont waterfront, right in the financial district in kind of Cole Harbor area.
Mhm.
So yeah, so we have almost 3,000 patients,
Wow.
and I've got an associate and a couple hygienists, and so we're a very busy office. But it's great. It's really awesome. Right now, of course, we're just on a skeleton crew, so that's only myself, a couple of assistants, and a couple of receptionists, and we're seeing all emergencies as per the college guidelines. But there are rumblings that we'll be able to open up to non-emergency procedures towards the end of May.
Hmm. And under regular circumstances, normally you specialize with cosmetic dentistry and implants, right?
Yeah, so I focus most of my time on more comprehensive cases such as surgery and implants and cosmetics.
Mm.
That's where I try and focus my time. That's what I really enjoy doing, and that's what I find also gives the most impact to my patients. Um,
Mhm.
it may sound cheesy, but I like to say we're changing lives one smile at a time.
Yeah.
And, that doesn't necessarily happen if you're just doing fillings. But if I'm doing like creating a whole new smile or giving teeth to someone who hasn't had teeth for a long time due to like with implants, then you're really making an impact in their daily life. So that's what I really love to do.
And it's the difference between smiling like this and being comfortable enough to smile with your teeth, right?
Exactly.
Uh,
Well, it's funny, all of the smile enhancements that I do for patients, it's really cool to see how many of them will actually just smile normally, and
mhm.
and they don't think about it anymore.
Yeah.
And that to them makes such a big difference in their self-esteem and self-confidence, and that's what dentistry can do, especially when it is referring to cosmetic dentistry. I
Mhm.
think that's the the best impact that we have on our patients.
How did I know you would do so well even back in the day? Okay. Try to keep you straight.
Right? I know.
How about okay, personal life? Like, are you still staying active? Are you playing soccer still?
I'm trying to play soccer, but I get injured like almost every other game. So, I'm 40 years old now. So the 40-year-old body can't last 90 minutes in a soccer game anymore, I'm afraid.
Yeah.
Uh,
But you
You know,
still like watching though, right?
actually, I rarely watch
All
soccer.
right.
Yeah, I hardly watch it. I'm too busy with work, and I do try and keep fit. Like I'll go running and cycling and stuff, and when there are classes, maybe the odd yoga class here and there. But
Hmm.
I usually am trying to play soccer and not watch it. But yeah,
Well, I do know you got out to the HSBC sevens this year.
that's right.
How was that?
It was a lot of fun.
Yeah,
Yeah, that was the last event before COVID hit, like Vancouver.
I know. I know. Like, yeah, that was one of the last events that my team worked as well. So it's just a little backstory. I was just editing the photos from the sevens, and then this guy's picture popped up. Yeah, you know what? Actually, let's show it.
Uh-oh. Well,
There we go.
there you are.
Tell us a bit about that costume you got on there.
Yeah, that's Ryan and Alina. Ryan is the creator of our. We were I guess dressed as IKEA bags or IKEA people. I don't know. We're wearing IKEA bags, so yeah,
First,
we're having a blast.
that's awesome. Was that the first year you went, or?
No, I've been like every single year.
Oh no way! Awesome. Yeah,
Yeah.
we were lucky enough. Our team has been involved in some shape or form since the first year.
No
And
way.
see it grow. This year, obviously the attendance was a little bit lower because of the possibility of the pandemic at the time. Like, I guess there wasn't much information about it.
That's right.
But yeah, it's if there was one event to sort of end it with before this, it was a good one.
Yeah, well, the fortunate thing about the Rugby Sevens tournament is that it wasn't a big source of infection of
Mhm.
COVID.
Mhm.
There was like what 100,000 people there over the 2 days,
Yeah.
and so if there was like I was infected with COVID, and it was actually just a couple days later or earlier at PDC. So, but I wasn't infectious at the time, so I know that it didn't carry on to other people. But
Mhm.
if that were a source, it could have been really bad for all of British Columbia.
Mhm. Maybe the costumes and liquor helped prevent the spread.
Yeah, maybe.
Yeah. So, oh yeah, yeah.
70, but you need 70% alcohol. That's pretty tough.
Yeah. It's
Not many
we'll,
people are there drinking moonshine, Chris.
we'll get to a little story there. I think once we did drink something that could have prevented anything. So COVID-19, what was your experience like?
It was I was shocked actually when we got the news that we had it, because I went to go to get tested on Wednesday, March 11th, and that's when I started feeling symptoms, and they were all pretty mild. But I was like, this doesn't seem right, and that was the same day that I actually heard that there was someone with COVID at the Pacific Dental Conference, and
Mhm.
that's why Pacific Dental Conference was in the news so much.
Yeah.
Is that one of the first people with COVID went to this event that had 15,000 people,
Mhm.
and then in the end, out of that one person going, 32 people got infected. And then, of course, whomever got that afterwards. But we also know that one dentist did die. I know another dentist almost passed away. And then a friend of mine, her husband was on life support for like a week, and he just got out of the hospital now. So it's really scary as to how bad COVID can be.
Mhm.
And my symptoms were incredibly mild. It felt like a cold. If I wasn't tested, I probably would have went to work the next day. I felt totally normal.
Right.
And so I just had a little bit of a nap, and that was about it.
Mhm.
And so I had, just for a little while there, some chills, some body aches. It felt like I had just worked out really heavily over the weekend,
Mhm.
and so I just felt kind of achy, and then I had a dry cough, and that was it.
Yeah.
And
So how many days did that last? You figure like less than a week or?
less than a week. Oh, by
Okay.
far, yeah. So by the time that I found out that I actually had it, I was
Mhm.
almost asymptomatic. The only thing that was lingering was my dry cough.
Mhm.
My wife got it a little bit worse, where she actually had a fever. We check our temperature every single day, and she was feverish for about 4 or 5 days,
Mhm.
and she just didn't feel as great. Um, and so I think it really depends on the person. Some people get it worse than others, and my friend who's a cardiologist in Ontario, he said that there may even be a genetic component, but he was just kind of theorizing. So it's just very odd how some people, even if they're young and fit, can get it really bad, whereas others don't really feel it at all, like myself.
Well, and that's the toughest part about it, right? Is that there aren't any set facts on this virus. You know, it's we're still learning as we go along. All the professionals are still learning as we go along. There's a new set of symptoms all the time, and like you say, like in your case, I'm glad that you were totally okay and it didn't impact you that much. But it's the complete opposite for other people.
Totally. Yeah. Yeah. So like the one thing that I also tried to do right when I found out that I had it is I actually tried to, like, I rested for like a day or so, but then whenever I could, I started running and cycling and stuff like that. I was trying to get outside as much as I could. Actually, well, when I actually discovered that I had it, obviously I couldn't go outside. I had to self-isolate. But what I did do is I used my trainer on my patio. And so I was on the stationary bike for as much as possible. And we did a lot of workouts indoors and stuff. But right around the COVID time, right before we got it, I was kind of like thinking to myself, okay, well, I probably need to improve my cardio and eat better and stuff like that. So I kind of did that in advance of everything as well.
Interesting. And then being a man of medicine, and I'm not trying to start any controversy or anything. It's just that I do know people that are on both sides of the coin. Some people think we should be back to normal today. Others agree that there should still be social distancing and we should take precautions until a vaccine is available. But I was just wondering your thoughts on, are we taking it serious enough right now? Or, is it just right? Should it be less? Should it be more?
Well, Bonnie Henry is certainly taking it seriously. The fact that elective surgeries still are not open is surprising to me. I think that should be happening pretty soon. And I think the dental offices should be able to open pretty soon as well. And even some of the stores that are open, they now understand like the customer flow and, having hand sanitizer at the front and maintaining social distance. If everyone is following all the rules, I think we can certainly open up. And, in articles from Business in Vancouver, they talk about the fact that if we were to open up and have twice as much of socializing as we are right now, there would not be a resurgence of COVID. And talking about a vaccine, that's a really interesting thing because we've never had a vaccine for coronavirus. Coronavirus is very common. It's a common cold. Right. And there was no vaccine for SARS. Mind you, SARS just went away, so we didn't need one at the time. So hopefully we will have a vaccine for COVID-19, but we just don't know whether we will or not.
Right.
And then, of course, you have countries like Sweden who are keeping everything open as much as possible and looking at getting herd immunity, which is where you have 70% of the population who have antibodies. But herd immunity typically comes from vaccines. And so that's the one thing that we don't know is, can I get reinfected despite having antibodies? And apparently there's studies from South Korea, or at least case reports, where 200 individuals have become reinfected.
Right.
So, and then there's some really good articles out there that are basing it on a number of cases per day or even ICU beds per day. And if you're not reaching your, whatever the definition of your threshold is within your area. Like I know that the number of ICU beds within the Vancouver Coastal Health is incredibly low right now. And talking with one of my friends at VGH, he said that they could probably accommodate for 5 to 6 times the numbers that they have right now.
Right.
So right now they've tamed the beast, so to speak, and they haven't figured out their therapeutics, but they've managed to they have excess capacity right now. So as a result of that, I think we're ready to open the doors.
Right.
And I think that the big caution and the big concern is how are we going to do that? But I think that now we're ready to move forward. And but I think we just still have to respect certain things like hand washing, bringing hand sanitizer wherever you go, not wearing gloves, but wearing masks for sure. If you're in enclosed areas, like if you're taking transit or if you're in like a car with people that you don't know, then certainly wearing a mask is appropriate. But
I got a bone to pick about the whole gloves thing.
What's that?
Because I do put on at least one glove if I go grocery shopping or something, right?
Okay, that's okay. One glove is okay.
And the glove hand is used to hold, the shopping cart or whatever.
Yeah.
And I make sure it doesn't touch my face or my wallet or anything else.
Yeah.
And then when I leave the grocery store, that comes off properly and into the garbage can.
I like that.
And then I hand sanitize right when I get into my car, right? And I take those precautions, but I don't take the glove and touch my face and
yes,
that stuff.
Well, that makes sense because the thing is, what I see people doing is they're walking around the grocery store with both hands on their phone, touching everything. It's like these gloves have no impact whatsoever. They're just giving a false sense of security. But I do like the one glove method.
Yeah.
So if you're touching your phone, touching your wallet, use that with your regular hand. If you're touching anything you're not familiar with, use a single glove. I'm okay with that.
Yeah, you hear that, people? One glove, not two. Not two. And I was getting some snacks or getting some stuff from the grocery store yesterday, and there's one woman walking around with a mask just under her chin.
I know. I've seen that so many times. It's hilarious.
What is the point of that?
I guess that's a fashion statement.
Yeah, I guess so. All right. So, okay, let's go away from COVID. We talk about COVID so much these days.
I know. Sorry.
No, it's fine. I really wanted to get your input on it, seeing that you had it. You are a doctor. I think a lot of people are interested to hear what you have to say about it. You briefly mentioned you were married. I did not know that.
Oh, you didn't? Oh, I'm sorry.
I didn't. I was going to ask, one of the questions was, what's going on with you right now? Like, are you dating? Or are you married?
No, I'm definitely married. Got married a year and a half ago.
Oh, congrats.
Beautiful wife, Ellie. We got married in Santorini, Greece, actually, which was amazing.
And where did you guys meet?
We met at the Global Restaurant grand opening at Telus Gardens 5 years ago.
Oh, wow.
Yeah.
I had no idea.
Actually, it is a bit of a funny story, and I always love sharing it because it sounds like it's from a movie. But I was there with my friend Kale, and I saw this girl walk by, and she gave me the double take. And I'm like, wait a second, I see what's going on here. So I lean over to my buddy. I'm like, okay, excuse me, I'll be right back. I have to track someone down. And so she's walking with her friends to what looks like the taxi stand. And I'm like, okay, I got to pick it up a little bit. So there I am speed walking through this big crowd of people. And I see her get into the cab with her friends. And she's literally about to close the door. So there I am on the red carpet pretty much. And I stop her from closing her own door. And I'm like, hi, I'm Nick Seddon. And she's like, hi, I'm Ellie. I'm like, Ellie, I need your phone number. And she's like, okay, here it is. I'm like, great, I'll text you later. And then, so I texted her that night, and then we went on a date the next week. And then our second date was not until maybe a month later, just because it was the middle of the summer and, what have you. But it was not until that second date at the Keg in Yaletown where that's kind of our official start date.
Amazing.
Yeah.
Look at this guy. What a stud. Holds a door and says, hey, I need your number.
Pretty much.
I don't think you were this confident in high school, if I remember correctly.
Not. This was not me in high school.
Your time will come, people. Your time will come. Awesome. So let's do a little flashback to the 90s right now. We're going to go back to high school now. I have a series of grueling memory testing questions that may bring up old trauma or emotions. Just kidding. It's not so bad. It's pretty light, actually.
I brought my tissues just in case.
Nice. Okay. So easy one to start with. Do you keep in touch with anyone from high school on a regular basis?
Generally speaking, I would say no, but in the last little while, I've chatted with Claire, Brian Mason, Sana, Abu Kazel.
Yeah. She might come up in another question here. I forgot now. Who was your best friend in high school?
My best friend in high
Yeah.
school. Well, I had several best friends.
Yeah.
I'd say like Tom Moxie.
Yeah. I was gonna say Tom.
Oh, that was the answer you're looking for.
No. I was thinking Tom. Tom is definitely one of them.
Yeah, and like Phil Reese.
Hmm.
Yeah,
Really? I don't remember you and Phil
we
like.
go out a ton.
Oh no way.
Yeah.
Crazy. Okay. Was there one person in high school that you thought was just so cool and like you kind of envied them?
Oh, that's a great question. Like, and now like looking back on it.
Yeah.
Oh, that's really good. I feel
Pro-
like,
Probably more so when we were in like grade 8, right? But
yeah, exactly. I thought Monique Ishikawa was super cool.
hmm.
Uh, Joey Pelche was super
Yeah.
cool.
The
Uh,
popular girls, right?
they're popular, but I don't know. They just had just confidence. Cody Bental,
Yeah.
um, JP Poirier.
JP, very nice.
Yeah, I think in like they were really interesting characters.
Mhm.
Yeah, they were very cool.
Cool. Okay, next question. Who did you have a crush on? Or name one girl that you had a crush on.
Well, there's a few.
They might end up watching this.
I know.
I almost wonder if I could guess who it was.
Oh, okay. Yeah, I want you to guess.
Okay.
Actually,
Well, my first thought when I thought about this question was maybe Santa. Santa might have been one of them.
uh, we were we were always like really good friends.
Hmm.
So
Matsumi.
yes, Natsume.
Ah.
That was
uh,
like grade 8.
yeah, yeah.
She was one of them. Megan Taylor, I had a crush on.
Yeah. So she was one of the Eastview girls.
Yeah, there you go.
Interesting.
Um,
Oh, so there's a few. I was wondering if
yeah,
like you were gonna even like share
there's
one
always
answer
a
with.
few. You can't just have a crush on one.
Oh man. Okay.
Um,
Give me one more.
Indra Kubicek.
Indra. Yeah. Okay. Interesting. All right. Who gave you your first taste of alcohol?
You did.
Thank you.
And it was disgusting.
Yeah. So total inexperience here. Funny story. Um, it was before a school dance, I think, and
Grade
somehow
9.
we ended up with these Long Island iced tea Mickeys, and of course, I had no idea. I didn't know we had to mix it with something.
Right?
So basically, we're just drinking record record head cleaner fluid. Essentially, that's what it was like. And
It was awful.
if I remember correctly, I regretted it a lot that night as well.
Well, I remember the taste of it, and I remember where we are. We were like in the forest drinking it, and it was like so hard to drink. And
And that's such a North Van thing. We were drinking in the forest
right, exactly.
before a school dance.
And the thing is, like, I don't even think I got drunk at all. Like, I don't even know if I got tipsy because it's just one of those things where you have no idea how much you're consuming because you can't drink any of it because it's so gross, right? Like
It was
why
like
would we
40,
drink that?
43% proof or
We should have
something.
just had like beer or something.
Yeah.
I don't know.
Yeah. It was easier to hide a Mickey, I guess.
Yeah.
See, but Nick still turned out to be a good boy. He was a good boy. Now he's a good man and still doing well. So I'm glad we didn't corrupt you that much. And even though I teetered on that fence of good and bad in high school, I think. But
Yeah, you did a good job of that.
but if I knew you were good, I'd still had your back and warn you a little. I think that there are some famous words there that I've said to you in the past.
Some famous words.
Don't be careful. Don't head down this dark path that you're considering right now.
I do remember that.
You're gonna be a doctor, so stay stay good. All right, who is the better soccer player, you or Gino Pizzeni?
Me.
You? He just had the height and then the Italian thing, right?
Yes.
He's
No,
gonna
but
be.
well, like he's like, don't get me wrong, Gino's a very good player. I just kept on playing, and then he eventually stopped. So
Yeah,
that's all.
yeah, yeah.
But back in the day when we were playing grade 12, like him and I were like the two leaders of the team. So it was always
Mhm.
really fun playing with him.
Yeah, I just want to stick it to him because I know he'll end up watching this one. The other option was maybe Brooke Parker because I do talk to him. Brooke owns a camera gear accessory company,
Uh-huh.
so I figured he might watch this too. But I honestly don't know how good Brooke was. So shout out to him anyways. Our graduation, we were pretty much ripped off in terms of the celebrating part of it. What was it? Our after grad was at this pool hall in Yaletown, if I remember correctly. And they didn't have an after hours permit. So I guess about an hour into it, we were kicked out. The police came and we were kicked out. All right. And I don't even remember what we did after that. And then we had a grad cruise that never left the dock. Um, yeah, I guess some people overindulged prior to uh, getting onto the boat.
Did you,
And
Chris?
no, I was totally fine. There are pictures. I took a lot of pictures that night, actually. So there are pictures of me totally fine. But I believe Claire was one of the ones who
You know what's so funny
messed
is
the
I feel
washer.
so bad because I threw Claire under the bus, but I did not throw Allison Cousins under the bus.
Was
I'm pretty
Allison
sure
gone that
it
day?
was Claire and Allison.
Ah,
And I mentioned in my speech at grad that and I believe my line was Claire Robinson not being able to find her sea legs, and I think I purposely left Allison Cousins out,
yeah.
and that's because we were scared of her mom.
That's
And
funny.
so, because Claire's so nice, I left
Yeah,
her there. I'm like, and I look up back on that, I was like, that is totally wrong. They were both at fault.
you know what? I would have come to that same decision too had I been in your place.
Right?
Because
Exactly. I really thought long and hard on that one.
well, because I did a catching up with segment with Allison, right? And that did come up. I'm like, I'm pretty sure your mom has scolded me before, but she did forgive me on her wedding day because I ended up photographing Allison's wedding.
Oh, no way. Oh my
Yeah.
God, that's hilarious.
And yeah, she said something to me that day along the lines of like, everything in the past is water under the bridge, right, Chris? I was like, yeah, I guess so. I didn't even know what
What?
you're referring to, but all right.
That's so
Um, all right. Last final question. One person you would love to catch up with, go grab a coffee with from high school.
you.
Yes. Awesome. And we
Does this
will do it. Yeah. Once the restaurants are open up again, let's do this over a beer and some food.
totally.
I definitely love that.
Yeah.
But yeah, thanks again for doing this today. It was great to catch up with you and hear that you're doing so well. I'm glad you are okay, even though you did catch COVID, but thanks for sharing that experience with us also.
Of
Um,
course.
and for everyone out there, check out oceanfrontdental.ca. Did I get that right?
Yeah.
Awesome.
And then my Instagram handle is Dr. Nick at Dr. Nick Seddon.
At Dr. Nick Seddon. We'll have it down here as well.
Perfect.
So yeah, thanks again. I trust this guy to fix my teeth. He's gonna have to eventually. It was
Looking
good seeing
forward
you,
to
buddy.
it. Yeah, good to see you as well, Chris. Thanks so
All right,
much for this opportunity. I really appreciate it.
no problem. Take care.
All right, take care. Bye.
Bye bye.